Good afternoon and welcome, everyone. My name is Sarah Harlan, and I currently serve as the Communications Chair for the Durham Special Needs Advisory Council, or DSNAC. We would like to thank you all for joining the DPS Exceptional Children's Department and DSNAC for our second educational series. This is the third session in this series. And if you have a child in Durham Public Schools that has a disability and/or an IEP, and you would like to better understand the various services available to them, today's session is for you. So we're glad you're here. Our desire is that panelists will be able to share their knowledge on what you need to know to better equip you to understand these services as a parent or guardian. And you can feel free to place your comments in the chat box, and our panelists will respond to each of them if they are generic in nature. If they're more specific to your child, you can reach out to the DPS EC department for further information. And a note that this session is also available in Spanish on the DPS Spanish YouTube site. And with that, I would like to turn the session over to our moderator for the hour, Ms. Crystal Roberts.
Thank you, Sarah, and thank you again for having me, panel. It is always an honor to be with you. Welcome to all who are here and listening and ready to learn. This is a forum about related services, and what I'd like to do is I'd like for each of the panelists to introduce themselves. And we'll start, I don't know if it's looking the same way to everyone, but we'll start to my left with Jessica Gunn up in the top Brady corner. So we'll start with Jessica and move from there.
Hello, everyone. Good afternoon. I am Jessica Gunn, and I am a parent of a youth with a disability in Durham Public Schools.
Tahisha.
Hello, everyone. My name is Tahisha Bishop. I serve as the lead speech language pathologist for Durham Public Schools.
Dr. Bell.
Greetings, everyone. My name is Kristen Bell. I am the executive director for the Exceptional Children's Department.
Cheryl.
Hi, my name's Cheryl Broadwright, and I'm the lead physical therapist for the district.
Lenore.
Hi, Lenore Champion, lead occupational therapist for Durham Public Schools.
Stacy.
Hi, I'm Stacy Burns. I'm the EC director serving all middle and high schools.
Summitris.
Yes, good afternoon. I'm Summitris Porter. I currently serve as the chairperson for the Durham Special Needs Advisory Council and also have a youth who is has a disability that attends one of our elementary schools.
Thank you. And we've met Sarah and Tosh Adams.
Good afternoon. I'm Tosh Adams, and I serve as the vice chair of DSNAC.
And we want to thank Javen Griffin from our IT department, too, for his wonderful, wonderful support. We'll get right into this conversation so that we can learn more about related services in the Exceptional Children's Department and what's available to you. And we'll start with that obvious question. What is a related service and how do families access them? And I'm going to ask Lenore if she will answer that question for us.
Right, so I'll start with what is a related service, and related services are supportive services that are required to assist a child with a disability to benefit from special education. So that implies, first of all, that a child needs to be eligible for special education. So they need to be identified as having a disability, and they need to require support services to help them access their education. And let's see, how do families access? Well, that's sort of implied in how I answered that question, but a student needs to be eligible, and families access or students access related services via their IEP, Individualized Educational Program. And generally speaking, they receive those services in their school setting. And I think that's my answer.
Thank you so much, Lenore. And I'll just remind our listeners and our viewers that if you have follow-up questions or burning questions, please share them in the manners that we've provided. Our second question is a question for Tahisha. And that question is, how is eligibility determined for related services? And it's a two-part, Tahisha. The second part of that question is, what is the frequency of services provided and how is this determined? You're muted.
I didn't want background noise. So as far as eligibility for related services, really you're reaching eligibility for special education services. Once that has been determined, the IEP team comes together and discusses, based on the data that they have for the different areas, what related services can support the overall eligibility area for the student. So it's very individualized, and it's really based on the current assessment and information that the team brings, parents, teachers, specialists, what we bring to get a good profile of what the student needs. As far as frequency, depending on what the need is, that will help to determine the frequency. If it's a mild need, moderate, an exceptional need, then that helps to determine. So it's really based on where that student is and that point in time. So it's really important that everyone shares their input on what they see the needs are in order for the team to make that determination, which can change as the student continues to develop.
That's good to hear that everything is personalized. Thank you so very much. Sherry, I'd like to pose this question to you. How often are youth assessed for eligibility and/or continued need?
So I'm assuming youth means middle and high school, or are we talking preschool all the way up?
I'm
Either.
not sure, Dr. Bell.
Yeah, I think for any child who's eligible for an IEP,
Okay.
so that would be any student age pre-K through whatever grade through high school.
Okay.
So we all do an assessment. Related services do perform an assessment, and then then we determine with the team and the parent, and the parent is important. We do a kind of a draft assess, a draft IEP, and we talk with the parent about goals, what their goals are, what their concerns are, and then that's when we determine what the need of the student is. It is personalized, it's individualized. Continued need depends on what the student has, what services the student has, and what the student services are needed, what is needed by the student. So
yeah, and Crystal, I would add a little bit more. The question about assessing and continued need, it really is kind of an iterative process and ongoing. And any team member at any point, even a parent, if they have questions or concerns or want to make any requests, that's always kind of open dialogue that could be presented to that team.
Yes.
So sometimes it's part of an initial evaluation where the team is, there's a suspected disability and the team's doing the first evaluation to see if that child's eligible for special education. That's also a time where they might also be looking at related services and do evaluations then. It could also be done during the reevaluation process, which at minimum is every 3 years, but can be really done anytime in between if the LEA, the district and the parent are in agreement with assessing earlier than that.
That's great to know. Open lines of communication and making sure that we keep that student first and foremost. So I'll go back to Tahisha. And here's a question for you, Tahisha. Speech, occupational therapy, and physical therapy are the services most known. What are some additional services that are provided?
Yes, in the area of related services, assistive technology is something that could be added as well. You could have counseling services, perhaps, that IDEA would allow for as a related service. Transportation, if that's something a student needs in order to access because of special communication or behavioral needs. So there are other related services that can also be added to the plan.
Thank you so very much. And Lenore, I'll bat this back to you. Our next question, and it's a two-parter as well. What is the overall goal of related services, and how might they differ from DPS providers versus private providers? For example, occupational therapy in a private setting may focus on sensory or eating challenges. In a school setting, we may focus on handwriting.
Thanks for the question and for the example. So the overall goal of all related services is to provide support for the student to access their educational program. And so we always keep that in mind. And I would like to say that the difference between a school-based provider and a community-based provider is that in school, we have a little bit narrower umbrella because we're focused on educational performance and participation. And in the community, our umbrella would be bigger. We would focus on things that impact a student's performance at home or, you know, on the playground in the park, or it's just a broader scope. So a school-based practitioner has a narrower scope, and it's all about a child's educational performance and participation.
Absolutely. Thank you so much, Lenore. Tahisha, back to you. What are the options for a youth who needs more frequency or intense related services provisions by Durham Public Schools?
That's a very good question. I think that's a parent concern that often comes up. Well, number one, you have to voice that concern. So if you do have issues, it's really important that as parents, you're part of the team. So you have to be able to voice that you want to talk about it, that it's something that needs to be considered. And then the next thing, the responsibility of the team and the LEA to make sure the team does this is to look at data so we can have specific things. So related services are specific supports because we want to make sure that we can achieve whatever goal or support that we have in place. So it will be important to, number one, voice your concern. Let's bring data. And for parents, that means your input and observation, because I like to say nowadays, I like to triangulate between what I see as a provider, what the teacher sees in the classroom, and what the parent sees as a carryover. And so bring your observations and data, and then we will look at the total profile of your student to see, okay, what's most appropriate. In special education, we really consider the least restrictive environment, which sometimes we refer to as LRE. And what we want to make sure is that they are getting the appropriate services they absolutely need and still be able to access as much as possible and appropriate for that student, the regular education setting. And so all of those factors have to be considered when we're talking about increasing or decreasing the frequency and the intensity of the services. And we like that to be evidence-based and research-based once we find the need. And so different providers in different areas have that information to help the team make the determination.
Thank you so much. That was a very comprehensive answer, and we appreciate that. Lenore, the next question is for you. And this question is, are related services available to youth at all levels, elementary, middle, high school? And how do they differ as the youth moves up in level?
So yes, the answer is yes.
Okay.
All related services are available to students, in at least in Durham Public Schools from 3 to 21. The way that they may differ is that you may see more intense services at younger ages, but you may not. You may, it's really individualized and it's based on data and the student needs. And so it's really hard to say specifically how they may differ because we really are individualizing that intervention.
Thank you so much. I'm loving to hear the common theme is that everything is personalized and individualized. I just love that.
I just like to add, Crystal, too,
Yes,
a little,
Stacey.
speaking as the secondary person.
Yes.
Another way that related services can be definitely different at the middle and high school level as they get to like 14 and over is that it may have a direct impact on their transition services, right? So we focus more life after. So what are the skills? So like with speech, if there's like a language or communication, we may focus on how is that going to affect them in the work environment or when they go to college, right? Like setting them up for success.
Yes.
T may be more for daily living skills, right? So we may want to assess if students are more severe cognitively delayed. We may want to look at assess their daily living skills, like how are they able to move more independently in the home, out in on their own in the workplace, right? Mm-hmm. And then like PT, may want to address the accessibility piece, right? What is it that they may need when they go to college so they can advocate for themselves, or if they're going into looking for apartments, what is it? How can we empower them and actually give, like, so we do the summer performance. We talked about that before. What all in that document that we need to hand over to, whether it be VR, whether it be employment, whether it be college, so that way the student can still have the access that they need in post-secondary life.
Thank you so much, Stacey. So that individualism is very important. Our students' success is very important. And then beyond Durham Public Schools, Dr. Bell?
Yeah, I wanted to add one more quick thing. I know on this session, we have our amazing occupational therapy, speech language, pathology, and physical therapy leads, but there are other related services under the Individuals with Disabilities Education Act that we also do provide in Durham Public Schools. So I wanted to make that clear to folks, like transportation is a related service. We have many students who need specialized transportation, which could mean they need a lift on a bus because their child is a wheelchair user. They may need extra support on the bus through support from a monitor, special pickups. We have some students that have nursing needs that's detailed in their IEPs, counseling, orientation, and mobility. There are so many other psychological services. There are also some supports to parents that we can put in IEPs if it's needed as well. So just knowing that really is a broad scope, but for today's session, we're really representing, I think, the three most highly accessed or some of the more highly accessed ones, although there are others. So just wanted to put that out there.
Thank you so much, Dr. Bell. And don't mute, because this next question is for you. Are Durham Public Schools providers able to collaborate with private providers when involved? And if the answer to that question is yes, what does this collaboration look like? And if you could explain why not, if the answer is no. And then this is kind of a four-parter. If not, how do they ensure that all services are working on the same goals?
What a great question. And we do get that a lot. Collaboration is so key, not just internal with our internal stakeholders, but also so many of our kids and families are connected with other entities and agencies and individual professionals. As much as possible that we're able to all connect and be a team to support the child, the better it is. So we are constantly advocating for that. Sometimes the parents bringing it up. Sometimes we're asking the parent, are you connected to other providers? Can we have consent to speak with them and collaborate? Sometimes the parents initiating that request as well. Either way, it's great. So yes, what does collaboration look like is a little bit different. Like I think Lenore earlier spoke to private services and eligibility and need can look a little bit differently than what's in the public school. So goals that we may establish in an IEP may be different than goals that a private provider is working on. And that's okay. But it is important, I would say, and Lenore, you can jump in on this, if we're providing occupational therapy for a child in the public school and the child's also getting private OT, for those two providers to connect with each other just to share what they're working on and share data, because there could be some carryover too. And that's just better for the child if there is, because we're being more consistent in our approach. We might be using the same language, and just wrapping around that child and family with consistency and support is so critical. I'm going to go back and see. So what oftentimes, oftentimes, on occasion, we'll have parents ask for their private provider to come into the school and provide services on site. That is not what we do in Durham Public Schools, because we want to protect the child's instructional time. The instructional day is so tight anyway. That's where that collaboration comes in. Like our OT would provide the services. They're collaborating with the private person, again, just as examples. But that person's participation support can come through the connection on the phone, email, and even participation in IEP meetings. Like a lot of times that provider, that parent can invite that person, and then they're a part of that team and sharing what they're doing and asking questions and learning from us, and we're learning from them. So I hope that answers all the questions. And I can also open it up to anyone else who wants to add to that from the team.
Anyone else?
I would just say that PT does a similar works with PTs out in the community, and sometimes the very important part of that is getting a wheelchair and talking about how a wheelchair might be used in school, how a wheelchair might be used, out in the community, that sort of thing. Or I've had multiple conversations with community PTs with what kind of other equipment is being used in the home, and is that appropriate for for us to use at school for the student to be successful, or that sort of thing. So
thank you so much. And I think Summitra's had a
Yes.
comment as well.
Yes, I do. Since I have a child that has all of these services, and one of the ways that we have partnered with or collaborated with the school providers as well as our community providers is looking at his goals. So I would give consent to the providers to talk to each other. So I'm not trying to convey information that I may not be skilled enough to do, but they are talking to each other about the goals, and they are collaborating about what those goals are and how things are going, whether they're at school or in the private sector. And therefore we're having a better conversation and trying to get to the end goal that will help the child kind of meet some of those goals that are established on the IEP. So we've done that a whole lot in the PT area, just like Cheryl talked about on the equipment functionality, but also in speech. There have been times where I may have gotten to an impasse at an IEP meeting with our speech provider, and I was talking to our external vendor, and so we could collaborate there to figure out, okay, maybe I'm not communicating effectively. Can the two of you talk about what the goals are, what I'm seeing, or what I'm trying to articulate, and then that may be a better way to kind of coordinate those services as well. So I think it's just a matter of just getting the two together so they can have a conversation to help best take care of the child.
Thank you so much. Lenore, and you're okay. I was going to say you're still muted.
Just very briefly, one thing that occupational therapists look at quite a bit is the environment in which the student functions, right? So the thing that would be great when collaborating with outside providers is to be able for the occupational therapists in the community to hear how the student is actually doing in their classroom. And then the converse is, or the reverse is true too. The community-based providers may have access to that home environment and may be able to see how the student does at home. And so they can have that conversation about the different environments, because it's really important to know how the student's doing, and also to make the environment supportive of the student. And that's really, really key as far as occupational therapy intervention goes.
Thank you so very much. And, Summitra's testament, or her experience and her comments were a testament to the collaboration and the partnership. And so I'd like to take the liberty of bringing Jessica back in, our parent rep, and ask a couple of questions of you, Jessica, if you don't mind. There are two questions that we have that we'd like for you to share with our listeners. What do you wish you knew when working with providers of related services? I'll ask that question first.
Okay. I would say my son started with Durham Public Schools at 3 years old, following his initial assessment, and he had all three: speech, language, and occupational therapy. The biggest thing that stands out to me is not understanding when you guys talked about it very nicely, the narrow scope in the school setting. And so I had high expectations going in for him receiving all those services. And the services, I will say, I mean, I've been very happy with all the services through Durham Public Schools. And they've done a good job, but I was not aware of how limited they were to the school setting. And so as he got older, some services he graduated out of sooner than I expected. And then some services he needed some additional support around. And I was able to figure it out and then get him some private providers, but I think I would have been able to plan differently had I had a clear understanding of that narrow scope going in. The other thing I would add to it is that just understanding all the options out there for him. We're getting ready to go into middle school, and I've been stressed about middle school since third grade. Because I mean, and I'm a adolescent therapist, so I understand what happens at adolescence. And I know middle school kids can be mean, but one of the things that we received through Durham Public Schools that I didn't even know was a related service till almost today, but it was another one of these webinars too that I learned. It was the transportation. So he rides the bus, and we depend on the bus because I work full time. But I'm thinking going into middle school, he's just going to be thrown on a bus without his monitor. And the monitor he has now, he's had since kindergarten. I know that will change. However, I feel much better knowing that going into middle school, that's a related service that he may be able to continue to use. And so just really for me, I knew these services were available for him, but really understanding what that meant for him.
Perfect. So summarily, what advice would you have for other parents as they navigate, related services for their child?
My advice would be, no question is a dumb question. Ask the questions. Even if, it's something that is your wildest dream, the school may be able to figure out how to meet you halfway, how to provide it on some level. And there may actually be a service out there for that. My child has a diagnosis of Williams syndrome. What they're known is their affinity for music. And I go to workshops often and they say, ask for music therapy. Now we haven't needed it, or it hasn't come to the point where I feel like I need to ask for it, but I'm like, oh, could I ask for that? And so I ask for it. The worst thing that can happen is no, but they may be able to incorporate that in the classroom somewhere, in music, in the specials. I think it's ask the questions, even if they feel like they're dumb questions. The other advice I would have is, when you get your contact information for your providers, reach out to them, introduce yourself, get to know them. Now that you're back we can go back in the schools, see them in the hallways. I mean, that was how I got to know my son's speech therapist. She would always be there at drop off, and I would chat with her for a little while. I'd get to know her, and just really, they're a part of your team just as much as that teacher. Connect with them and get to know them.
Jessica, thank you so much. That's excellent advice. Excellent. I'm going to now go back to Tahisha with this question. If we assume that equipment and assistive technology fall under related services, what type of equipment and assistive technology is provided by the school, and then who is responsible for those services and who manages communication with the servicing providers. That's a mouthful, I know.
It is a mouthful. That is excellent. Assistive technology is an option for related services. We talked about that. Every time we do an IEP, there is a question about assistive technology, whether the student needs it or not. We want you to consider all of the different factors, all of the different needs. So that's something that teams are reminded of annually when they do those new plans. Now, with assistive technology, I like to summarize it as we go from no tech to high tech. So again, it's individualized to the student and what the student needs, what their special profile is. With assistive technology, it's not automatically iPads for everyone. Just considering the skill that the student already has, the other needs that they may have, you may be looking at a communication notebook, something that's not electronic, something that allows them to focus on the communication that they have, as well as intermediate devices that are voice output, devices that have limited pictures so that the student will be able to scan and select. So with assistive technology, as we all know, or many of us know on this call, assistive technology will often include a PT and an OT and a speech, because it's also how can they access it, what's appropriate for their level, and we take into consideration how that's going to communicate their needs, but they have to be able to access that in order to communicate. So it could be no tech all the way up to high tech. And I will say, I think that we have the best assistive technology team in the state of North Carolina. It is so comprehensive. They work so collaboratively. I really feel that they are experts in their field, and many other districts and LEAs just don't have that wealth of opportunity as Durham Public Schools does. So I have to, pump them up and just say, I think they are amazing. But whatever you're looking for assistive technology, like Ms. Gunn says, express your voice, express your concerns. Let us all work together. We're experts on the children in our fields in different ways to have that discussion. So from no tech to high tech, it's possible. And of course, it's individualized. So we may find that maybe there's an assistive technology need that the OT is going to serve and manage, rather than somebody from an assistive technology team. So it really is nuanced, and it can be nuanced from plan to plan and year to year and child to child. So there are so many possibilities, which is why it's important for everybody to talk about it, so that we can come up for the right solution for that student, whether they're in pre-K, transition to middle school, whatever the setting is, we can address it according to that. And then we want the communication to be everyone. So one thing with plans, we all have our expertise, but what we want is everyone to partner. So when a student gets an assistive technology device, whether it's a no tech, a little book, or something like iGaze, something very much that has to be calibrated and very technical. What we really want you to walk away with assistive technology is that this is the student's voice. Don't take away their voice. Right? We don't want anyone to take away our voices. Don't take away their voice. Help them to use their voice across settings, use it at home, make it fun. It's so important for them to be able to communicate. So when you say who manages it, I want us to all partner on it. As a speech person, that's going to be my number one thing. We all have to partner for communication. Nothing that these students do rests only on one person. We all are collaborating and partnering together. But if you have any questions, as a team, go to the case manager, like Ms. Gunn said so well, make a connection with your providers, whether there's related services or the teacher, make those connections, ask those questions, get the conversation started so we can all partner and manage. But if you have a big question, talk to the case manager.
Thank you so very much. And I think Samitris has a question or comment.
I do. Thank you. I would like to say that, yes, the assistive technology team is great. We went through that evaluation. I would say pack snacks. It's long. It's very tiring for the parents and the student. So, but it is very thorough though. And they go through a series of different technology options for your child. But, we went through that and we implemented it. I think this was happening right at end of COVID. And so we didn't get to implement until we came back to school. And we're really finding out that it's probably not working well at this point for us, but that was based on a collaboration with our speech, OT, and the teacher, right? And to Ms. Bishop's point, not losing voice for the child, because I was always concerned, my main concern is that he has voice, that he can communicate. So let's not take all of that away from him with the device. So anyway, so we did the assessment. That was great, but we did understand when we got back to the classroom that probably is not working to the best, in his best interest. And so that we are not limiting his abilities to use his voice. And so, but it was good to know, because I had no idea that that existed or that was an option. And so going through these things and, now that you can tell others, but our parents like to know, what are their options? As Jessica said, we just like to know, what's the smorgasbord? What can we choose? Can we choose 1, 2, 3, 4? We want these 4, not these 3, like that. So thank you for that. And as Dr. Bell said, there's so many more things that are out there that we are not even discussing today. So I just wanted to add that 2 cents, Ms. Roberts.
Thank you. Thank you very much for that. And Lenore, I'd like to ask you this final question. It doesn't look like we have any other questions from our viewers at this point. But this last question is, do you have related service providers who speak Spanish? And if there's no one available, how do you manage communication with Spanish-speaking families?
Well, we do have providers that speak Spanish. For instance, Tahisha does speak Spanish. I don't, and there are a number of service providers who don't speak Spanish, but we do have access in Durham Public Schools to the Multilingual Resource Center. So we can access that. We also can have some of our documents and handouts and things. We can have those translated so that families can still have access to them. At least I can speak for the occupational therapists. We make every effort to make our written communications accessible and to have interpreters whenever possible to collaborate with families. And I would, if it's okay, I would like to say one more thing about assistive technology, and that is it may not be about communication, no offense to Hisha, but it may be something that's very low tech and about supporting a student in a classroom, like a sensory support, maybe a little fidget or some seating that allows them to move rather than, constantly be sitting still. Those are, I would say, would also be assistive technology, but not, really high tech like some people might think. Sherry would probably also say that supportive seating in the classroom that's not necessarily a wheelchair, but it's still supportive, might also be considered assistive tech. So I just wanted to mention that just as an addition to what Tahisha talked about.
Thank you so very much. Tahisha, you have a comment?
Yeah, I wanted to add the comment about the services. I think, what was the question again about Spanish services?
Yes. Do you have, excuse me, related service providers who speak Spanish? And if there is no one available, how do you manage communication?
Exactly.
With Spanish-speaking families?
I just wanted to echo what Lenore had already said, that we do use the resources. Durham Public Schools has those resources for interpreters to be there. And also so that it's a good team discussion. Everyone gets to have their voice. And also just to consider with the umbrella that we talked about with the services that are at schools, that it's an educational service and how they're accessing their education. And so we want to use all the best practices to bridge the gap when students have a different language, but understanding that we are giving the services so that they'll be able to better access the instruction that they're given, which in this case in Durham Public Schools is English. And so an interpreter might not be provided for the related services and for the instruction. But we will do our best practices to bridge the gap so that when we partner with these skills, that parents understand what we're working on and that we're working on the principle of the skill, even if the languages differ. And so that those interpretive services are really important. Very important for students. And then we have interpretive services for things like students who have American Sign Language that they speak and those kinds of things. What we want to do is do our best practices, bridge the gap, get everyone involved. And so for the services themselves, there might not be a need, but for everyone to be on the same page, we want to make sure those services are provided. Interpretive services.
Thank you so much. And I think Sherry had a comment as well.
I had a hand up, and I just wanted to say that once again, this district has really supported our students as far as larger equipment, PT, more like equipment, and they've done a great job. And you know, we've got a lot of newer equipment, whereas when I started 100 years ago, you know, the equipment was probably 20 years old. So we try to get the best options for, we try to provide the best options for our students. Sometimes it's not always right away, you know, within the first month, but we do try to, if we can't get it right away, we try and get it in several months, as far as that goes. So
thank you. Thank you very much. I think what I'd like to do is just go around the virtual room. I'll start with Dr. Bell and see if you have any last thoughts, any, summary, any questions that you might want to pose to those who are listening. Dr. Bell.
Thanks, Crystal. Yeah, I think if anything, I would say it also prompted me from something that Ms. Porter had shared about her experience. It really is a team process. There's so many great experts with knowledge, as well as the parents' expertise, knowledge of their child. So the closer that communication is and the tighter that collaboration, the better it's always going to be for the student. Just as we may do an evaluation and recommend something, and maybe it works for a little bit, but we're collecting data and the needs of the student changes. We are going to be responsive to the changing needs of the student. We need to be. That's what the IEP is. It's a living, breathing document. So if something isn't working that we started, we get together as a team and say, why is it not working? What do we need to do differently? And then the other thing I would say to Sherry's comment about equipment, yeah, sometimes it requires, the needs of the child requires us to purchase some things. And we do have a responsiveness to that when the IEP team has made that determination. Most often, if there are delays, it might be because of the supply demand chain and other things that are out of our control, but we do understand the necessity of getting things, items, resources into the hands of our students and teachers as quickly as we can. So,
Dr. Bell, thank you for reiterating that. Anyone else in our virtual room who'd like to share any parting thoughts? Ms. Simitris?
I don't have any parting thoughts, but I do
Okay.
have a question that's on top of mine. Only, and I think it was talked about initially at the outset, but I want to make sure. For those parents or families that have kids transitioning to high school or middle school, how are these related services similar or different? What should one expect that may be different than their elementary experience? Does that make sense?
Yeah, that's a good
Okay.
question.
Okay.
Well, I don't mind kind of jumping in because we've emphasized so much that it's individual. It really depends on what is happening as they move through their DPS experience. For instance, you might think that, you're giving a lot of services, let's say for speech language, maybe they're using a device, but maybe those services may wane as the student is more independent. But then if something does change, perhaps they have a new device that happens in high school. school, well, you might see that those direct services might increase because the profile, the need of the student in that moment in time really justifies and warrants that they need more services. So it's very hard to say exactly what the needs are from pre-K to high school, because it really looks at what that student needs in that moment of time. The biggest job that we have to do is to see the student, assess what the need is, that need that has to be met, not just things that benefit, the thing that the student needs. And then based on that need assessment that the team brings in, then to put the services in place. So it really does fluctuate year to year. And so it's important that you bring up those concerns or whatever that you're expecting, share your expectations. And that's what I would say also, like, sometimes we just don't know. So share what your expectation is so that the team can help based on the data and the observations and the input to help with your expectation. Doesn't mean that it has to change, but maybe you'll get more information that will help. It just looks so different for every student. And we're glad that we can uniquely meet the need of the student as things change.
Yeah, and I would say, like, the quick takeaway there is what we're doing for the child should not be contingent upon whether they're in elementary, middle, and high, or preschool, whatever level they're at. It's about what that child needs. So if a parent is experiencing or hearing something differently, you definitely need to reach out, because that's not how we make decisions.
Great. That's a great point, Dr. Bell. But to add to that, Ms. Bishop, so at what point then would a parent and the provider, right, be having these evaluations or conversations then? So, because I'm assuming sometimes the person, I can't think of the provider may be a different provider at that high school, at that middle school. So at what point is that, when are they having those discussions? Because if I have an IEP meeting in March and I start school in the fall and there's a new, so when does that happen?
That's a good, yes, great question. First of all, I say that it should be ongoing. The best practice, and we sometimes talk about this explicitly as a staff together, that the best practice is to have ongoing communication. At the start of the year, when you're a new provider introducing yourself, Ms. Gunn said it well, and that would be one of my parting talking points, is that connection. First, connect. Always take the opportunities to connect. And then one thing as a provider I like to do is I like to let teams, like I'll talk to a teacher, I'll tell a parent way ahead of time, if I'm seeing progress, I want you to know about the progress. I want you to know about it so that you can see if there's carryover, if we're seeing the same things, or maybe there's progress with me and no carryover. All of it is great data and a great profile of how the student is doing. So I think to answer that question, it has to be continuous, like connect right away, continue with the communication, and always be collaborating together. That's really the key to make it work. And so that the profile that we think we have of the student is the most accurate one to make the best plan for the student. Does that answer the question? Because it should start right. It should be continuous. It should start as soon as you meet your provider.
It kinda does.
Can I add one piece to that? Is that because you made, Ms. Porter, about elementary, middle, and high. So the conversation starts in that transition meeting. So both providers should be at that transition meeting to hand the child over, right? So the middle school provider is listening and learning, while the elementary person is giving information, right? And so both school teams are there. So one is giving information, the other one is listening. The receiving person is listening and learning, and then asking questions. And so at that meeting, that's a prime opportunity for the parent to say, okay, my child has gone from going to maybe an elementary school, like, so I'm thinking of speech and language communication, right? Mm-hmm. My child is going from one elementary class and maybe some specials, traveling with the same group of people. Right. Now they're going to middle school where they're traveling with different classes all throughout the day and different people. what is that going to look like for my child? Those are some of the key questions. Like you want to, as a parent, to walk away from that meeting, visualizing yourself in that classroom, seeing what's happening. And if you can't visualize that and understand and comprehend that, don't walk away from the meeting until you actually get that. And have a list of questions that you may have. And also, it's also a team. So some of the team members would may be able to give some input to the receiving team on that student. So it's the initial conversation starts there. And there's always that I can pick up the phone call, like Ms. Bishop said, and call the provider if I have more detailed questions. Does that make
you? Yep. And I think that would be, that's what I was trying to pick up on, and make sure our families knew that there's a transition meeting that should be occurring and those handoffs are occurring. And that's the point. Okay. Yep. Thank you, Ms. Burns.
Great. Thank you so very much. Before I pitch this back to Sarah to wrap us up, I would like for Dr. Bell to share with our listeners and viewers contact information, because we truly are blessed to have all of the professionals whom we have serving our students. And maybe Sarah or Summitris will provide DSNAC information as well. Dr. Bell.
Great way to wrap it up, Crystal. Thank you. I would always encourage parents to stay closely connected first to their school-based team. So that would be your child's general education teacher, if they have one, and special education teacher, and the related service providers. So, keeping that list of who those folks are and their specific contact information is really critical, whether it's their phone numbers or their emails. Next level is, if you have concern, is definitely working with school administration, the principal or assistant principal at the school, to do some problem solving. You also have an exceptional children's facilitator in Durham Public Schools that can be of support. The next level after that, people are always welcome to contact our office, our EC Central office. We are here to support any situation. We're also happy to hear positive things that are going on. So feel free to shoot us an email for that. That's always awesome. But you can find our contact information on the DPS website. It will have our office numbers and our email addresses. And don't hesitate at any point in time if you need support from any of those levels. But do try to start at the school level. But if you feel like you've done that and aren't feeling successful, please don't hesitate to reach out to us.
Thank you so much, Dr. Bell. Sarah, I pass it back to you so that you can provide DSNAC information and wrap us up.
Thank you so much. For those parents who are looking for additional information and who want to be connected to other parents of students with IEPs in Durham Public Schools, I encourage you to contact us at durhamsnac@gmail.com. It's Durham SNAC@gmail.com. And we also have a Facebook page. And so you're welcome to join that and connect with us there. And most often we, for very technical questions about DPS, we refer you all to the EC department, but we also have a group of parents who connect as well. So thank you all so much for joining today. On behalf of DSNAC, we really want to thank the DPS EC department for your wonderful partnership on this series. And thank you all so much to the panelists for sharing your insights today. And we encourage everyone to join us for the next session in this series, which is April 19th, on the topic of self-advocacy. So we'll talk about preparing and empowering our students to participate in their own IEP process. So we really look forward to that. And we wish you all a wonderful afternoon. Thank you. We'll see you next time.
Thank you.